Hi, and welcome back. I am Paige Elizabeth, and this is Creating Consciousness, and I am here with Cody Gao. She is a clinical pharmacist, correct?
That's right.
Yes, and I took to her content on TikTok because she was one of the few women who were discussing fitness in terms of how to sync it with the female rhythms so you can optimize output and get the most out of your routines. And she is very familiar with GLP-1, so we're going to dive into some conversation about the do's and the don'ts, some proper ways to get the best out of things and vice versa. So welcome.
Thanks, Paige.
So tell us a little bit about yourself first.
I'm a clinical pharmacist, mainly working in the obesity and diabetes space now. Lots of patients on GLPs, but just really trying to encourage lifestyle change, proper nutrition, movement, to optimize, help my patients that don't want to be on GLPs, help my patients come off them, help my patients that need to be on them. But fitness and lifestyle optimization is my love and my passion. So I'm really just an advocate out here for strength training and helping women do that. And I think a lot of women really struggle when they try and do that out of sync with their own bodies and their own rhythms. So allowing women to kind of have just another way to touch base with that, to be in tune with that in order to be able to live a healthier, more fitness-based life, I guess.
Absolutely. So with your work as a clinical pharmacist, you don't just prescribe, you coach them through things as well?
Yeah, that's primarily my job is coaching, counseling. So I'm a pharmacist who counsels, and I like to definitely inform patients that yeah, as we're losing weight through any means, it doesn't matter if you're on a GLP or if you're just calorically restricting on your own, you're going to be losing a mix of lean mass, muscle and bone, and fat mass, and we're just trying to mitigate that loss, while we're on a journey to get a healthier weight.
So, from my own personal experience, like I'm 43 now, and I actually come from the yoga world. I practiced Ashtanga yoga for 22 years, which is, if there's any form of yoga that is extremely intense and will build muscle, it's Ashtanga yoga. Um, so I've gone through a lot of different phases. For me, food is medicine. I don't believe in absolutes for diet because I think that the body changes. We go through different seasons. I was a vegetarian for 13 years until my body said, "You're not doing this anymore." At 26, my body was like, "No, we're not. You're going to eat me now."
Yeah.
Gave gave that lifestyle up, started incorporating meat again, and that was fine, not an issue. Now I'm like red meat every day. Um, what I find, and this is a conversation that I have yet to see anybody have, because you have the keto world where people really believe in keto, carnivore, fasting, things like that. And then you have the fitness world where they're like, how dare you go keto, right? Like, make sure you get your carbs. But no one really talks about the 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 defining reason why one would work and one wouldn't. And my personal experience brought me to that place where I was like, okay, I liked keto because as someone who was practicing extreme yoga, I just wanted to keep the inflammation down. I quit yoga at 38 or something, 37, got into lifting. And I was shocked over time at how my body revolted against me, saying, we're not doing this without carbs. And that's actually how I ended up kind of thrashing my nervous system and my HPA axis, is because I was trying to build muscle and lift heavy without the proper nutrition. And I just found that to be just fascinating. And I'm like, well, no wonder there's two schools of medicine, because I feel like the ones who are advocating for keto are sedentary, and the ones who are advocating for carbs obviously aren't.
Yeah, I think first off, I was a big Ashtanga yoga person myself, so
Really?
I did
Really?
it. I loved it.
Who did you practice
Um
with? Now
but yeah, lifting is my love now, but definitely Ashtanga yoga is fantastic. I think there's obviously there's just deficits in every fitness modality, so being able to cross train and enjoy different things, I think is great. Um I think that you're right in regards to keto and sedentary lifestyle. Depends what type of carbs you're eating. They can be very inflammatory or not. But especially women, I think what a lot of women don't know is you burn more fat throughout the day if you have carbs on board prior to a workout. So I think that is a big piece, an active woman. And by active woman or athlete, I'm referring to a woman engaging in some sort of activity on purpose. I don't mean like you're performing a sport well, because people are like, I'm not an athlete, I'm not an athlete. Like, it really doesn't matter how well you're doing the thing, but if you are engaging in something active on purpose, like I'm considering you an athlete, and before you do that thing, it's really important to have carbs on board because I don't make the rules, but women's bodies were designed to create human life. Um, and we are particularly sensitive to stressors. So a man can go and train fasted, no carbohydrates, um, take a cold shower, do his workout, pile all these stressors on, and his body is designed to kind of step up in areas of stress because he needs to be able to perform. Whereas a woman's body, we have an extra area in the brain called kisspeptin. We're a little bit more sensitive to these stressors. Our body is like, wait, 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 there's no food. Now we're engaging in an activity. Oh no, we're not going to be able to create human life. We're not going to be able to procreate. So now we're down regulating thyroid. We're down regulating all of these things that has an impact on our metabolism throughout the day. You you might not notice it, but you're going to start to engage in less activity, neat the non-exercise energy expenditure throughout the day, where all your fidgeting, all your walking, the way you breathe, you're just not going to be you're not going to be doing that as much. You're going to be sitting down more often. You're going to be more tired. Um, Things that you don't notice, and that is the type of metabolism that you have the most control over is your non-exercise resting metabolism. So when that goes down, you're burning a lot less calories if fat loss is the goal. So having a little bit of carbohydrate on board before you work out is going to pay dividends throughout the day to be able to burn more calories and to burn more fat. And it's not intuitive. So I think women, I like to use the prototype, my mother, because she wants to lose fat and she'll be like, I'm gonna wake up, I'm gonna thrive off this cortisol. You know, you
Mhm.
get this big spike of cortisol in the morning, you're like jazzed to wake up, you're motivated, you're not very hungry and I'm just gonna go in and I'm gonna work out. And if I don't eat, obviously that means that I burn more and I'm gonna lose more weight. And that's just not the case because now you're functioning, the functionings of your body are gonna start to and go down, slow down. You're going to be hungrier throughout the day. You're not going to be satiated as easily. So these just factors because your body's trying to fight to be able to get back to get yourself to a non-stressful state where you would be able to grow a baby inside of you. So it doesn't have to be offensive in my opinion. We can just know that the design of our body is as such that we have to make it feel comfortable and safe in order to do stressful things. So if we're going to engage in a stressor that's healthy for us, a hermetic stressor, if you will, like work out, we have to make it feel safe, which means you have to get a little bit of carbohydrate on board. Um, and and I think you reach your goals faster that way instead of like going backwards to go forwards.
No, absolutely. I mean, it blew my mind how, like I said, how metabolically expensive lifting is. And I don't quite understand the mechanism as opposed to like I was an acrobat. Like I said, I finished fourth series Ashtanga. Like you want to talk about like excelling. but nothing had my body going mm-mm. Until I started lifting. And then literally, like when I was in my crisis mode, and my one of my TBM practitioners was just like, your body wants carbs. Like, I don't know what to tell you. Like, it doesn't, this keto thing, it's not working anymore. It keeps coming up carbs for you. And I was terrified because I had actually really learned to optimize without. And so it just didn't make sense to me. I was trained, that carbs create inflammation and all this stuff, but actually they don't if you're building muscle. Like I didn't understand that. And so I went through kind of like a crisis in terms of my philosophy for a minute too. Um, and now in hindsight, I'm like, I wish I had learned this at 20.
Sure. Yeah, and immediately metabolically expensive. Like if you're trying to lose weight just by the calories burned during a strength training session, it's not that much depending on how hard you're going, maybe 100, 200 calories or something, which I think adds up over time. But the thing is, it is muscle is our most effective organ at disposing of glucose. And we can just get rid of it, which is actually fantastic because, if you're a diabetic or something like that, if you just move your body, heavy strength training allows us to transcribe GLUT4 receptors to the membrane independent of insulin. So basically, it makes us more insulin sensitive. Um, and you might think, well, I just don't need, I still don't want carbohydrates on board. I'm trying to get rid of sugar. But if we want the muscles to be able to perform at their best in order to make those adaptations and changes to insulin sensitivity, metabolism throughout the day, all these things, we have to give it what it needs. And it needs, and not a lot, just needs like, a little bit of fuel. Um, Protein, carbohydrate before we work out. I like, a yogurt with maple syrup, honey, dates, like whole foods. I try to do whole foods as much as possible. I was a really big protein shake person. I still am now if you're on a GLP and you just cannot get the protein in with whole foods. But I obviously everything is nuanced, but I really try to do the whole food approach. And a lot of people will be like, I just can't. I'm not hungry. And well, yeah, you're not going to be hungry if you've trained your body your whole life to not be hungry when you wake up in the morning. It might take a little bit of time. Maybe it's just a little bit of nutrients in your water. Maybe it's some maple syrup in your water to start. You have to train your body to produce acid at specific times. And I maybe some people have sensitive stomachs, and you might not ever be able if you work out in the morning. You might not ever be able to have. Um, a snack or a meal before you work out. But I find most people, if you incorporate it slowly, start moving your meals earlier and earlier in the day, with the goal to have some nutrition on board prior to your workout. You can train your body to be able to do it. It's just optimizing and giving your body what it needs so that it can perform the task, so that you can make positive changes.
Oh yeah, no, I have pasta before I go to the gym now. Like I don't hold back now.
Amazing.
Um, but it's just a fascinating, like I said, the cognitive dissonance, that I personally went through, and I know a lot of women go through. Like they're so afraid. And yet the thing is, like, muscle mass is just, it's like if you build that, it just will metabolically stabilize everything.
It's amazing. And I think there might be a lot of older women in this group that are really, really terrified of putting on mass. My stepmom, I was trying to talk her into eating more protein because I wanted to see her get to a certain weight. She's underweight right now, and she was like, "I can't be that weight. I'm going to be fat." I was like, "You're not going to be fat if you're gaining lean mass." But when you live through this whole like heroin chic era where the smaller you are, the better. I think a lot of older women are really struggling. I think that we really have to remember that we are trying to fuel and train to thrive. And I want her to be able to continue to pick up my daughters, her grandchildren. I want her to be able to step down off a stair and be able to catch her weight, um, so she doesn't fall down. If she does fall down, I want her to be able to absorb the ground. There's just so many like strength markers I think are so important for us as women so that we can thrive later in life, um, and avoid injury. That really should be the priority. And it doesn't have to be at odds with aesthetics either. Everyone thinks that that's at odds with aesthetics. I think it can be both things. We don't have to make ourselves as small as humanly possible, to fit like some sort of made up aesthetic. I think if we're strong and healthy, like I think it's beautiful. So
Well, I think the aesthetic part, like I have had body dysmorphia my whole life, so I can relate to the aesthetic part. And it's really just this trauma that's always doing the talking, you know what I mean? But it's not real. Like my weight has not changed in the last 5 years, but I've gone from 25% body fat to 20. Not even by like trying to cut, but that's just kind of what's happened, right? So, and that's more or less the look I'm going for, right? Is to be lean. And it's interesting because when you're young, like it doesn't matter. You know, I always tell people, I'm like, well, now that I'm older, I have to build mass for aesthetic purposes. Otherwise, everything will sag, you know? So like it just happens, you know? So if the aesthetic's important to you, you might want to put on that mass. Otherwise, everything is going to droop. And with the muscle mass correcting things, you know, there's always talk about high blood sugar, but no one talks about low blood sugar. And I don't run high blood sugar. I run low blood sugar. And that's why I couldn't fast. Like it did so much damage to me and totally threw me into sympathetic dominance, made things worse. But again, the muscle mass corrected the low blood sugar. I don't have low blood sugar issues anymore.
amazing.
So, yeah. And I mean, I eat more comfortably now, like in terms of whatever I want, than I ever did in my life. And my body handles it better.
I love it.
Yeah.
And don't get me wrong, I have the same fears. Like I don't want to be bulky. I don't want to look like this like huge woman. I want to feel feminine too. Like I have the same concerns. Those just live inside of me. I think one of the things that people don't talk about that much is actually, if you don't want to build mass and you're looking to maybe lean toward the strength aspect of things, the heavier you go is better because if you're doing that 6 to 5 to 7 rep range, um, failing at 7, so like as hard as you can with good form, that's going to lean more toward strength training. But when you have higher repetitions and it takes you longer to come to failure, maybe at 15 reps or something like that, so actually a lower weight, that's where you kind of get hypertrophy. So that's the rep ranges where people are trying to get big and bulky, but true strength training tends to be lower reps. So really, if we want to focus more on strength instead of bulk, we should be lifting heavier.
Well, that's so interesting because I just this summer, about 6 weeks ago, I went from progressive overload to endurance. I was like, you know, you can keep stacking it on me. Maybe it's because my nervous system's been primed for just explosive movements my whole life. You don't climb 30 feet in the air and do moves. You know what I mean? Without that, um, what is it, the fast twitch muscles?
hmm
So it like wasn't hard for me, and I didn't feel like I was getting any like visual results. I was like, okay, I'm strong, but where I want my body to look a different way. And so I was like, let me just see what happens. Because I had seen a video where someone said it was a fitness influencer, and he said that studies are now showing if you just do one set to failure, you actually have more luck building hypertrophy. And I was like, well, I've never tried that. So I lowered all of the weights, like anywhere from 2 pounds to 10 pounds, depending on if it was like triceps or hip thrusts, right? Oh, it's a whole other game for me now. Like it's hard now.
Yeah.
That's what I've been doing for the last 6 weeks. And I get through my workouts faster, but I am like, wow, tired afterwards.
Yeah. Yeah, I think it's good to always switch things up. I would speak to our peri and postmenopausal women, anyone who's watching or listening that as we lose estrogen, so as estrogen comes down, we lose more of a hormonal stimulus for strength. Um, so we need that heavy
Mhm.
strength training in order to compensate for that. So I definitely think that's true. I would say as we age and go into that post-menopause stage, if you're not taking any kind of hormone replacement, estrogen is sort of like the anabolic hormone for women. As opposed to testosterone for men, it is anabolic. So when it's going down, plateauing, we really have to replace that with stimulus. So I think the heavier the better for our older women, which they tend to be more scared of it. And I'm like, this is super important because that going to failure piece is not going to work for you anymore when your sex hormones are, just at a different phase of life. We just have to replace that with stimulus.
Oh, definitely. If you're a beginner, I wouldn't recommend what I'm doing. Um, but also because for me, like what I found was I was compensating so much. Like I just was recruiting from everything to get the job done. And I'm like, well, now I
Hmm.
can't get specific to the muscles I'm trying to work.
Or yeah,
And so that was the other reason that I decided to try something different. Because I was like, I
yeah,
really want to feel this muscle, and
yeah,
I was so good at just like recruiting to get the job done. And I was like, well, this
right.
is working.
Yeah, I think there's a place for compound lifts and for isolated movements. I'm like not like a zealot for either. I think that they're both so important.
Yeah, definitely. You talk a lot about like the different activities at different times of the cycle. When you are cycling, can you elaborate on that?
Yeah, sure. I think the primary thing that's most important is that we're all so different. So step one for everybody throughout your menstrual cycle really needs to be tracking. I think a lot of women know that they feel differently, and they might joke like, "Oh, I'm about to get my period," or whatever. They just notice different symptoms, but they don't actually have that pinpointed to when they experience that or how they experience it. So if you take a few cycles just to kind of witness and see what comes up for you, see what happens, because we're all different. We all have different hormone receptors, different sensitivities to those receptors, different sensitivities to hormone drop-offs, things like that. So we really need to know how we experience our cycle. That's most important. I can talk about the stereotypical cycle
Mhm.
and what you might see happen and what might serve you to change it up a little bit. But at the end of the day, because we're all so different, some women don't notice changes at all. We really need to dial in on that. So, for instance, there's two different cycles, right? There's our two halves of the cycle, 1 to 14 and 14 to 28, for anybody that doesn't know. And that's our ovulatory cycle. So 1 to 14, we are follicular, and 14 to 28, we are luteal, roughly. Ovulation can happen at different times. And then overlapping with the follicular cycle, we have the period. And some people feel awful during their period, and some people feel great. The day before my period, I feel amazing. I'm like, I know I'm about to get my period. I'm about to enter follicular. I am ready to go. I'm jazzed. For other people, they have a lot of inflammation. They're dealing with cramping. They're dealing with heavy bleeding. They're dealing with things like that. So that would be something to note. Leading up to your period, we have this giant increase in progesterone in the luteal phase, and right at the period, it drops off. And it's this high to low, this change that I think is difficult for a lot of women, myself included, um, where it's difficult to deal with. I think it's really magnified in pregnancy, at least for me. After you have a baby, progesterone drops off the face of a cliff. And for a lot of women, it's like, oh my God, you feel horrible all of a sudden because it's just a gigantic change. That's why, you have postpartum depression. So that change can be really hard on the nervous system for me in particular. So I really take that time to be more skill-based, more mindful, just be just be understanding that our body's going through something right now and we might need a little bit of a rest. Going into the period, some people might need to take a couple of extra days because they're still struggling with a lot. I think the struggle during the period is usually inflammation focused instead of hormonally focused because our hormones are low. So it's that inflammation, and actually what I believe to be very anti-inflammatory is sprint interval training, which women are like, you're gonna tell me to sprint on my period? Absolutely not. And if that's your reaction, fine. Like just take a few more days. If it's not for you, it's not for you. But I mean true sprint interval training 1 to 2 times that first week. It's so anti-inflammatory. It does that same thing with insulin sensitivity. I really love that. And then you can ramp up your strength training as you go into ovulation. Estrogen is starting to rise. Estrogen is the star of the show. It feels really good. It helps us, you just feel like a superwoman sometimes in the gym. You just have like this extra superpower and you're like, I'm here. And I think the value to tracking is you never miss your superpower days. Because sometimes you might just be like, oh, I feel great. I'm going to go to the winery with my friends. I look good. I feel good. But if you kind of are like tracking and you are just being mindful that you are going to have some really great workouts and your recovery is going to be really great. Just want to make sure I don't miss those days. It could be advantageous for some women. Some women have like a day or two during ovulation where they feel horrible, and I think that's good to know too. You just might want to get it in a couple of days early and know that you're going to have a little dip during ovulation. And then we just start to pull off as you go through the luteal phase. But it doesn't have to be exact. It depends on how you feel. And you don't have to play a guessing game either. I really like some tools that are more objective, like a dead hang. So you hang from a bar when you walk in, when you go into the gym, you can time yourself, and how long you can dead hang on the bar can kind of tell you like the state of your nervous system. And you would really know this. Like other things can affect your nervous system. You could have had poor sleep. You could have drank alcohol, whatever. I do think you will see like a change throughout your menstrual cycle too. And that's just a tool you can use. If you don't like that, there's a finger tap test on your phone. It'll tell you like how many times you were able to tap. I like that as like a marker
Interesting.
as your nervous system, just try to see where you're at because you might be like, okay, it's after ovulation. I'm going into the luteal phase, but I still feel really good. So I'm still gonna try and hit some hard workouts and I'll be able to recover from this. I think a lot of times what people don't realize is the benefit you're getting from your workout doesn't happen during your workout. It happens during recovery. Recovery is where your body makes the changes that were elicited by the workout. So if you can't recover from it, it's not going to do you as much good as if you are able to, and you don't really want to waste your time, if you will. So being able to hit those hard workouts when you're able to recover. And then as you're moving into late luteal phase, where a lot of people are sort of feeling down, if you're not tracking, I think this is where a lot of women quit. And they're like, I feel awful. I'm just not cut out for this. I'm not gonna go. I'm not gonna do this. And then at the end, they're like, oh, I didn't even show up to the gym for a week. Like, I'm just not, and they just don't go back. So I think understanding that it is cyclical and it will start over and you will feel good again and you will be able to go back. Just gives yourself like a little bit of grace to be able to take that little section off for rest or skill-based training, walks, handstands, whatever brings you joy. I think has a lot of benefit because we can just understand that we're cyclical and that we're not required to be motivated and feel like superwoman 100% of the time.
I don't think I'm ever motivated. I just keep showing up.
I love that too.
Like
Uh,
never motivated. It's just part of my routine.
I
But it's
love that.
fascinating because, like I said, I do a lot of nervous system work. I've done some huge nervous system rebalancing this summer myself. Like I had a situation pop up, and when I went to confront it, so basically I had this doctor who I've worked with for 25 years who in his work he was just starting to touch me inappropriately, but not on purpose, but just out of just habit. And I'm like, I think he's just gotten too comfortable with me. I don't think he's even aware, but he's a little bit of a dick. And I was like, I could be completely forfeiting this relationship if I confront it. But I was like, you know what? I'm not going to do that to my body. I'm not going to betray myself. So I'm going to confront it. But I'm so used to people just, when you speak from a space of truth, people don't like it. They often deflect, defend, like they do that, the typical. So I was prepared, but I was going to show up for me anyway because that's part of the nervous system recal is using your voice and validating yourself. He responded with so much grace and so much just like, I'm so sorry. I wasn't even aware I was doing this. In fact, you're one of my most confident, boldest patients. If this is happening to you, this must be happening to others. And now I'm thinking and wondering, and thank you for bringing this up. I wasn't prepared for that. And I just broke down in tears. Like it fragmented an old defense mechanism in me that just was like so used to having to brace. It just shattered it. And I literally, for 10 days, had nothing. I was so fatigued. Like it blew out old circuitry that I literally had to go through and reparent and recalibrate and do all this stuff. And so it just, yeah, I wasn't prepared for that, but forgot where I was going with this. What were we talking about before I came up with this?
I don't know, but it's so interesting that we're gonna have like a life experience that can affect our nervous system layered on top of the cyclical thing that we have happening every month. So I think this is where a lot of people will just quit and be like, or a lot of women in the fitness industry that are very fit fluencers will be like, that's too much. You can't expect women to keep track of all of this. But I actually don't think I think you get better at it the more in tune you are with your body. And if if you're tracking, whether you're journaling or you're using an app or whatever, you're just witnessing like this thing happened in my life. I didn't get that much sleep like last night, or I was drinking, or this is the place in my cycle. I think it just brings awareness to your body. You kind of just get to know your body better.
Yeah, totally. I mean, in hindsight, it actually made things better. Like once I was able to clear it all from my system, but it took like I had to upgrade everything after that. Like it literally took an old paradigm that I had been living off of for 40 years and shattered it. And so like the fatigue was insane, like insane. There was nothing nutritionally going on differently, but because this had happened, it was severe. And so
Yeah.
for like 2 weeks, I just wasn't able to do what I wanted. But I'd go for walks. I was like, I don't know what's going on or how I'm gonna like it was a healing crisis,
Yeah.
but eventually, my body did kind of catch back up and we were able to reset things. But yeah, it was pretty intense. But I guess my point is that just, I'm never in the mood. Like life always happens. Yeah, but if you're committed and you're consistent, it's very rare that I will just go for a walk. But if that's what I need to stay in my habit, that's what I will do.
Yeah. I think that's just as important to know is that we're just cyclical. And, if a walk is what serves us right now, like it doesn't make us less than, it just makes it the best thing for us in that moment.
Yeah, definitely. So with my work, I usually finally get women when they're in what I call stage two burnout. So stage one burnout is you're just stuck in sympathetic dominance. You're living off of cortisol and adrenaline. You're go, 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 go. You're not sleeping through the night. You have anxiety. That would be stage one burnout. The body can stay there for 5 weeks, for 5 years. It depends on that body type, but then eventually it'll go to stage two, which is complete adrenal, just burnout. Now they're low cortisol, they're sleeping 12 hours a night, but they're not feeling rested. And that's usually where people will go, okay, I need help. Stage one is where they're like, I'm fine. In fact, I'm more than fine.
Yeah.
And this is where, when I have conversations with these women, they're like, no, I'm going to go work out and I'm going to lift. I'm going to do all this stuff. And it's like, and I look at them and they're whether they're heavy or not, there's no muscle mass going on because cortisol is catabolizing all of it, all their efforts. And I had learned this through my own recovery, but I didn't know the link between insulin resistance as it pertains to stress until my doctor said, well, yeah, insulin and cortisol, they're competing for the same receptors. And so cortisol always wins.
Hmm. Yeah, I think that's physiologically advantageous, right? Like it's important. Your body thinks that cortisol is trumps because if you're in a stressful state, you're probably in a dangerous situation, and your biology wants you to be able to survive a dangerous situation. So it's always going to choose cortisol. Um, Insulin being anabolic, cortisol being catabolic. And like we were saying earlier, you're just layering more stressors on. Um, so so you're layering, we're producing cortisol when we work out too, because working out is a stressor, but it's a hormetic stressor that we need to prioritize. So in order to prioritize that, we really need to know how important it is to bring down the anxiety. You know better than I how to do that, how to calm down our nervous system so that we can perform and recover. When we have too many of those stressors layered on top of each other, it's just not going to work anymore. Our body's going to start to to defend itself, use its defense mechanisms, and we're not going to be able to perform. Yeah, I'm not sure where I was going with that, but
It's one of those days. Yeah, so the second half of the cycle is where progesterone climbs and we become more insulin resistant, right?
Mhm.
And so this, I think, is the part of the cycle women run into issues without realizing.
Yeah, yeah. So we're building a home for a potential human being, and that's like hard work. So people think about the period being stressful because there's blood. But the 2 weeks leading up to the period are we're in our uterus, we're building tissue. So we're diverting nutrients and energy there. Um, to build up this thing that could potentially sustain life, and that takes energy. So we're a little hungrier because we need a little bit more calories to do so. Not that much, 1 to 200 maybe, but the hunger doesn't always reflect that. Your body might be telling you need an extra 500 calories. It's not that, but if we can make good macronutrient and micronutrient choices, it usually makes the satiation a little bit better. Um, and the priority during that phase of the cycle is building this home. It makes our nervous system feel a little bit off. We're not really able to recruit as much for strength. We might feel a little bit weaker. We're not as heat tolerant, which is surprisingly important. Um, because when our body takes on heat as we get hotter, we have mechanisms in our brain that try and stop us from doing whatever it is that we're doing that's making the body heat up. It's a safety mechanism. So you're going to get tired, you're not going to feel as strong, you're going to feel weaker because your body's like, whoa, whoa, whoa. Whatever you're doing right now that's causing your body to heat up, it needs to stop. Um, Progesterone brings our basal body temperature up already, a little bit. So we're running hotter too. Um, all these things we can address. You can train your body, sauna as you're active, as you're training through your cycle, your body's gonna feel a little bit safer in these areas. But it's also important to know there's just a lot going on, and we might not be able to put as much weight on the bar or whatever it is you're doing, and you might just have to pull back a little bit and focus on other areas of your training.
So would you say that like top half of the cycle to you can scale back calories, carbs work harder, bottom half of the cycle not work quite as hard, more calories, more carbs.
Yeah, I definitely think we're more stress resilient in the first half of the cycle. So if you want to layer on more stressors, our body's able to take it on. If you're somebody that's dealing with you're not able to ovulate or you're dealing with fertility issues, then it's a different story. You might have to work with a specialist. You might have to pull back a little bit right before ovulation too. But I think for a blanket statement is that first half of the cycle, we can go a little bit harder. We can push our bodies a little bit more. Um, Cold therapy is a big contentious topic right now. Lots of women don't do well with it. But if you are interested in cold therapy, cold plunging, I do think concentrate that to the first half of the cycle when we're a little bit more stress resilient, for sure. And then the second half of the cycle, particularly the week leading up to our period, we definitely just have to take a little bit more care to make our bodies feel safe.
And you do a lot with GLPs, which are very popular right now. Um, I don't know how I feel like across the board. If you're really, 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 really heavy and you've got a lot of nervous system noise, I think it's appropriate to have an intervention. My concern is just the long-term use of them. In fact, when I was in my recovery, I was like, I want to try it. Like I had 5 pounds to lose. It wasn't anything crazy, but my goal was to see if it would calm cortisol. I was like, I just want to see if it'll calm down the cortisol part because I can't reduce my calories without that just constantly just hitting. And so I couldn't do more than zero point 0.8 a week of semaglutide. Otherwise, I got really sick. It did lower my blood sugar almost dangerously low initially. That was not good. Um, and coming off it, like for me, it didn't do anything, really didn't, except maybe lower the cortisol. I still had to count calories. It wasn't like this magic thing for me. Coming off though, I had a permanent blood sugar headache. And my TBN practitioner had to correct my pancreas. Like, but for 2 months, I just couldn't get away from this blood sugar headache. So there are those side effects, right? Like I wanted to see if it really was this great thing. And like I said, I think it did help keep cortisol from spiking so that I could fall asleep. And um, but but so I have tried it. But when it comes to your work and, assisting women to get to their goals, what patterns do you see? What recommendations do you typically make?
The patient populations I'm usually working with have a quite a bit of weight to lose. I'm not a big fan of using GLP as a assisted weight loss if you have a little bit of weight left to lose. Um, but people who have a lot of weight left to lose, I would love to counsel all day on not using GLP and everything that can be done nutritionally, exercise to get people there, and I will continue to do that. But I hate to see someone, I have family members that struggle with morbid obesity. I would hate to see my patient population that just isn't getting there for whatever reason. I won't call it like a willpower thing. I won't call it anything. I'll just say that they are likely going to live out the rest of their lives with 50 to 200 extra pounds. And the health complications that come with that, I do think are much worse than being on GLP. So if that's the comparison, definitely recommend GLP for those patients. I think we're at risk last time I checked for 8 additional cancers and obesity, and who knows what that number really is. Heart attacks, all sorts of complications that are associated with obesity. So definitely think it's important to get to a healthy weight. I would love my preference is drug-free. Um, but if it's not happening for you or somebody makes the choice that that's just not the route that they're going to go on GLP, then I'm going to help you do it as healthfully as humanly possible. And I think the most important thing to focus on when you're on a GLP is maintaining lean mass, whether that be muscle or bone, because it is so metabolically active. It is so important for longevity. And people are just so excited to lose weight on a GLP. They just stop eating and they lose weight way too quickly. They're like sweet. If they weren't strength training before, they're usually not starting. So you're not strength training, you're not eating enough protein, and you're losing weight. And when we lose weight through any means, whether it's GLP or not, we're gonna lose all sorts of mass, lean mass and fat mass, muscle, bone, fat. So I'm really trying to encourage my patients that they need to hold on to that lean mass. For me, it's longevity reason is the most important reason. I want you to be able to regulate your blood sugar. I want you to be able to hold up your own body weight, all of these things, but it's aesthetic too. If, like you said, if you're losing lean mass, you're not going to be able to hold up your skin any longer. So then you get that Ozempic face and the Ozempic butt and everything that everyone's talking about aesthetically. And I just think it's really important for people. Instead, I don't think they should use it as a crutch. I think that they should use it as an identity shift, like a James Clear style habit change, where you're like, you know what? I'm losing weight. I am healthy. I can be healthy. I am a person that goes to the gym. I am a person that cares about what food I put in my body, and kind of let the medication put you on a path, a trajectory of a healthy lifestyle instead of a crutch where you're just trying to use it and let it do the work. I think can be valuable for people going on the medications.
Well, because the argument I always hear in comment sections of women who, like, this is by the creator themselves. Like, I got on GLP, I finally lost all the weight. And I'm like, but did you try to build muscle mass? Did you even try that route? And they're very defensive that like this was the only way for them, but they never tried to build any lean mass. And that's where
Yeah.
I feel like the other thing is it had occurred to me recently watching a video of a woman who was like, I just needed to get the noise to stop. So I got on a GLP. And that hit me because I was like, your body's not trying to convenience you, it's trying to give you signals that it needs help. And
Yeah.
your solution is to just shut up the body. And so it makes me wonder how many people who struggle are actually dealing with trauma dysregulation, like their bodies are dysregulated because of something they didn't address at some point. Like that's where the weight came from, you know?
Hmm.
So I'm going to dive more into that research soon. I'm really excited because that didn't even occur to me until I watched that video. I was just like, all I hear is shut up, body, you know?
Yeah. Yeah, interesting. Yeah, I'll be excited to see what you come up with. As somebody with like an extremely addictive personality, I definitely have a lot of empathy for someone who just cannot stop eating or has no control, or it just like the hunger just takes over and you don't feel like you have another option or choice. I definitely think that there's a lot of other avenues of quieting that noise. Um, whether people are interested in exploring that or have the bandwidth between work, whatever their financial status is, whatever their parenting stressors are, it's just so different from everyone. So I try and just like remain empathetic. But I definitely think that there's a lot of factors that are super going to be super interesting to dive into as these medications likely remain popular. So I'm excited to see what you come up with.
Well, I mean, I had an eating disorder. I struggled with all of that myself, but then as I changed the relationship to myself and was just starting to heal, because I mean, I lost my hair because I was traumatized. I mean, that's
Mm,
clear, right? Like that was the issue. I was abused. So like when you start to repair all those parts, the body can regulate and then the noise calms down and so do the impulses.
yes.
So it's really powerful work, but that it just like I said, her video made me go, I haven't made that connection yet. Okay, that's interesting. But
Right.
and that's where I feel like GLPs are great in the sense that if you are huge and you just have all this noise, we do need an intervention. But at what point do you look at your nervous system and the imprinting and the lifetime habits and you know what I mean? And then choose actions out of love versus out of spite.
Yes. I
I
think
don't
it's so
show up
important.
at
I
the
think
gym
it's
because
it's
I
hard.
hate
It's
myself.
it's so important. I find it particularly in practice hard to lead people there. But I do think it's important looking for more tools to be able to lead people there practically, you know.
Yeah, I mean, Because when that shifts, then you're making decisions from a healthy place as opposed to, and I've just watched my own body just change. Like I don't crave sugar anymore. I did crave sugar for 20 years, like I don't anymore. I've done a lot of work. My microbiome has changed.
Yeah,
The reparenting has really shifted my brain and chemistry. Like it's all just different now. Um,
amazing.
and so, like it is possible. And when I look at women who, like I have a client in mind specifically who was always lean her whole life until her last child, but it was on the heels of just huge issues with the spouse, and they're divorced now. And it just flipped a switch in her and she put on all this weight. And now she's
Mhm.
dealing with the trauma and the weight, but it was like she was never heavy. And boom, it just hit her hard. And she said, like, after I had my last baby, like, I literally just shut down. I forget which one is which, Ghrelin or Lipton, but she said no matter, I would eat like 5,000 calories a day and I just couldn't get satisfied.
Right.
I was constantly hungry, and that was never the
Yeah.
case before.
Yep.
So the physiological things don't happen in a vacuum. Something shifted the signaling, and I think those
Hmm.
are important things to look at if you don't want to be dependent on a GLP.
Yeah. I think there's a lot of value on in not being dependent and solving that equation.
Yeah, I mean, I think it's miraculous when I see women who are like, finally, I'm lean, and I get that feeling. I don't want to take that away from women, but the true empowerment would come from knowing that like it's there inherently on its own
Yeah.
without
Yeah,
outsourcing it.
absolutely. Hmm.
So definitely,
So
is
follow you.
there, yeah. So, is there anything in specific that you're like, I wish every woman could just hear this or know this? Is there anything that you'd like to share?
Yeah, I just wish every woman knew to give their bodies grace because it's doing a lot. It's doing a lot under the surface, and with trauma, like you spoke about, we're dealing with that. And our body is constantly cycling during its cycling years. And that's hard. And that's hard work. It's hard work on our nervous system. It's hard work. It's hard work on our physical bodies. There's a lot going on. And I think we deserve to give ourselves grace as we try to push forward and just use it as a way to remember that we're cyclical. We need to give our body rest in order to be able to push forward.
Yes, like I concur. As I have honored that cycle, my outcomes have been better.
I love it. Me too.
So I didn't have to start listening until my mid 30s.
Yeah, we can get away with a lot when, like I like to say, when we're in that youthful fountain of estrogen of early 20s and like just we have a lot of wiggle room. Our bodies are very resilient. But I do think the earlier we can catch on, um, the better our outcomes will be because the longer we can work with our bodies and let it perform at its full potential.
Well, and I don't know about with your clientele, but even with nervous system dysfunction, like I really went into this as women over 35, right? That's kind of the marker of like when the dysfunction shows up physiologically. No, I get client calls from girls in their late 20s and early 30s. And so I'm wondering, like, you probably are starting to notice these trends younger and younger too.
Yeah, it's creeping that way for sure.
Cody, where can people find you?
I am Dr. Cody Gao Fit on everything. I took a very long hiatus from social media, and now I'm getting back into it, developing more free resources, developing more paid resources, hoping to be more active on socials over these next few years. So that's where you can find me. Mostly TikTok, Instagram, Facebook.
Perfect. It was lovely having you.
Thank you so much for having me. This was fun.
Thank you as well.